So we are going to be doing a little bit of Botox today for our lovely nurse Sarah. And looking at her, certainly you don't think that she'd need Botox. A lot of young people are doing it for preventative reasons, and Sarah falls into that category. So Botox is very popular. It's been around for more than 30 years. It's very safe. And when we're injecting it around the eyes, our goal really is to weaken those muscles that are called the protractors of the eyelids. Protractors are closing muscles. So we blink or we force our eyes closed, and by injecting those muscles, it opens up the area around the eyes. But certainly you don't want to inject too much because you want the eyes to still be able to close. And we're going to start by just testing Sarah's protractor activity. So Sarah, close your eyes really tight. And so you can see this is the orbicularis oculi, and relax. So it creates a lot of fine lines around the eyes in the outer corners that we can see. And now frown. And these are the corrugator muscles that create the 11 o'clocks. We can see there's also a bit of these nasalis muscles that create some bunny lines here. And relax. And for Sarah, her retractor muscle of the forehead, called the frontalis, isn't so overactive, but certainly some people do like having these this forehead muscle injected to take care of those lines as well. So Sarah, if you'll just raise your eyebrows and relax. You do have to be careful getting those injected, because for a person where they already have some deflation and descent of the brows, it can make a person look a lot more hooded. So you have to be careful if you're getting those injected. Some people do like to get Botox in the outer corner because it kicks the tail of the brow up, and that works nicely. And in those cases, sometimes we balance it off by injecting a little bit to the forehead. So let's get started. So Sarah, if you'll just close your eyes, we do like to clean with a little bit of alcohol and sterilize the area. And we're going to be injecting the glabellar area first. So Sarah, frown and relax. So just pinch, pinch, pinch. I like to just pinch, pinch, pinch. I like to inject deep right into the muscle belly. How are you doing, Sarah? Any discomfort?
Yeah.
Perfect. And then we want to hug the 11 o'clock on either side, and that catches the corrugator muscle. Now with Botox, the effect of it usually takes about 3 to 5 days for it to kick in, and then it reaches its peak effect about 10 to 14 days. It usually lasts for about 90 days. Botulinum toxin is also made by a few other companies, and it's known under the brand name Xeomin, made by Merz, and Dysport by Galderma. Now, I'm just going to clean here a little bit more. And now we'll clean the lateral orbicularis oculi, and smile and relax. So here we inject a little bit more superficially. Many different strategies when you're injecting the outer lateral canthal area. Again, if you inject a little bit higher into the brow region, you can kick the tail of the brow up, which some people like, some don't. I tend not to inject too far lower than the lateral commissure because you can get a little bit of a droop that doesn't look very aesthetic. Sarah, smile, smile, and relax. The first few times you're getting Botox, it certainly feels a little bit uncomfortable, but it's not a particularly painful process, as you can see with Sarah's relaxed body language. And finally, we're going to do a technique that I would recommend only if you've had Botox in the past. Some people tolerate it better than others, but it's kind of like a lip flip technique, and to soften some of those, lipstick lines that are above the lip here. So Sarah, if you'll just purse your lips, good, and relax. So good at that. And we inject a tiny amount of Botox here. Again, this is something I wouldn't do as your first injection because you may not like the way it feels, but if you can tolerate it, it actually creates a beautiful look that will give a little bit of a flip to the upper lip without injecting any filler, and also helps soften and prevent some of those deeper lines, those lipstick lines or smoker's lines. Well, thank you to our wonderful model, Sarah. Now, often people ask after Botox, like, should I stop working out, or certain things I have to avoid? Really, the big thing is you probably don't want to do anything that exerts yourself too much in order to avoid bleeding or bruising for maybe the next 12 hours. I also tell patients not to try to make faces over the next few days to see if it's working or not, because you can recruit accessory muscles. But otherwise, when you're injecting deep into the muscle belly itself, there isn't a whole lot of other restrictions. And again, in about 3 to 5 days, you're going to start noticing the effect of it kicking in. Thank you.